Hi, my name is Dan Gomez, and this is Mental Health Supra Omnia. Mental health above all. We identify and understand mental health issues and the paths for help. Today, we want to talk about ADHD and, if time permits, anxiety, and in particular, the impact on both the parents and the child. We have with us today two guests. The first is Jackie Corcoran. Jackie has over 30 years experience. She's currently director of the Doctorate in Clinical Social Work program at Penn's University of Pennsylvania School of Social Policy and Practice. She's written 18 books. I know she has another one or two that are about to come out, and over 100 journal articles and book chapters. Her areas of scholarship include adult and youth mental health. We also have with us today Erica Burgoon. Erica is a member of the leadership team at Equilibria and is a licensed clinical psychologist with over 25 years of experience. She provides clinical services across the lifespan and specializes in working with depression, anxiety, and trauma. Jackie, we've read your book, Your Child's Mental Health Diagnosis, a comprehensive and compassionate guide for parents. I normally hold up the book itself, but today I've only got it on my Kindle, so when I'm holding up my Kindle, I found the book to be quite instructive and helpful, very easy read for parents, and again, like I said, very helpful. Please start by summarizing what a parent sees when their child has ADHD, and what is the impact on the parents themselves?
Well, I think, from an early age, parents are going to see a child that just takes a lot more energy to parent. So the effort that they're putting up just seems so extreme compared to other parents. And it's just very stressful on a daily basis when a child is not following directions and not doing the things that they're supposed to be doing, not following routines, and, is walking in a line somewhere and then takes a detour. And so it's a constant process of having to get them to do things that they're not interested in doing. And a lot of life is very routine and we have to get through it. So what I find is the parents just struggle on a daily basis. It's a kind of a 24-hour undertaking to deal with all the routines of life, and just a lot of effort has to be put out all the time. So parents just can get very exhausted. And what I found really interesting from studying this topic is that parents with children diagnosed with ADHD were much more stressed out than parents parenting children with any other diagnosis, even ones that you might think of as very stressful, such as autism spectrum disorder or an intellectual disability. And that parents with the child with ADHD seemed much more stressed out overall compared to these other groups of parents, which I thought was quite striking.
That really is striking. And I think there are so many ways that parents, I see this in my own work a lot, this really hits close to home. And I'm so glad we're here to talk about this today. There's so many ways that parents can experience that challenge and also experience their children's challenges. And I think we're thinking a lot today about how two parents in a household may actually experience those challenges in different ways, or may perceive their child or their child's challenges in different ways. And then seemingly you're adding another layer of stress potentially and struggle to the household, that you may have parents who don't see eye to eye on what their child's experiencing or what they should do about it. I imagine that introduces, I shouldn't even say imagine, because I really do see this in my work a lot, where that introduces an additional element of stress into the household.
Yeah, I mean, parents almost inevitably have different parenting styles. Like they come from their own families of origin with their own way of doing things. And, I think it's more the rule rather than the exception that parents in general have differing styles. But yes, when you have a child with ADHD, then it becomes very striking. So, I mean, I'm just generalizing a lot, but it's often, mothers who have the day-to-day challenge of dealing with all the routines throughout the day sees the behavior most closely. and the working parent doesn't see all the things that have to happen each day. And so they may not have an appreciation for it and think that their spouse or partner is just complaining about normal child raising. Or they think the mother usually, again, is too lax and too forgiving about everything, and that they should be stricter on the child. That's another common pattern. Because ADHD, it has a genetic basis, about 40% probably of children may inherit this from their parents. One of the parents may have a diagnosis themselves. And it could be either parent. So, sometimes that is helpful in terms of the parent just having a little more understanding of what their child might be going through. Sometimes it doesn't, because a parent may lack awareness of that and act toward the child as people have acted toward him, maybe, being strict, criticizing, why can't you just do this? Why are you so lazy? Just the messages that they may have gotten. So they may, sort of not purposely, but reenact that kind of thing, the same thing that they experience. So, I think parenting is challenging anyway, because parents come from different perspectives. But with something like this, where it's kind of important to get on the same page, because consistency is one of the things to offer. And it's just, it seems basic, but it's very difficult when you're stressed out like that.
Yeah. Yeah, I find that for so many parents and families that I've worked with, as you said, the stress of maybe related to parenting a child who has additional or different needs starts long before the diagnosis.
Mm-hmm.
And then, once there may be an evaluation and a diagnosis, I think I've seen for some families that makes a shift. Okay, this has a name now. And for other families and couples, if we're talking about parenting, it doesn't necessarily. There's still a difference of opinion about what's going on with the child or how to approach it. And I know that can actually feel really devastating to the parent who maybe was championing let's get the assessment, let's see what the professionals say.
Mm-hmm.
Those differences of opinions don't always go away at the time of the diagnosis.
Right. That's true. Yeah, that is true. And usually parents, there's enough appointments with the child with this diagnosis, or enough, having to go to the school and appointments with this doctor and that doctor. But, couples counseling is an option for people, I think, who do have these stark differences, especially when it has repercussions on the children. But, that's another whole thing, like whether people willing to do that, whether they see that as an option for a problem such as this. There's a lot of layers to that as well, as I'm sure.
Sure.
Mm-hmm.
You mentioned this, that often the general care of the child, and then that can include going to the child's appointments, going to the school, tends to fall on one parent more often than both parents equally. And, frankly, still in our society, that's often moms.
Mm-hmm.
I often find that the parent who's the one that's participating more in the services then ends up also in the role of needing to educate, the parent that's not able to attend. You mentioned couples counseling. I sometimes will talk with parents about even if the parent who's not able to attend as many appointments can maybe get to a brief psychoeducational group that may only take place over a few sessions or even one day.
Mm-hmm.
Yeah, I'm curious if there's any other approaches you've seen that sometimes can help the parent that doesn't get to be, maybe as part of the child's treatment or that world.
Yeah, thinking about other ideas. Sometimes it helps for that parent to spend more time with the child, so having the parent who usually does it not be available for however long, like during the weekend or whatever, and, give, just so that they get the sense of what this is like. Because, sometimes, and again, I'm just going to use traditional terms because, as you pointed out, this is often how it is, you know. So a mother will kind of act as intermediary between the child and the other parent, and we'll always kind of get involved if she's there. They're not going to not involve her if she's there. She might also have the propensity to jump into the situation to help. And so sometimes I think it's good just for the parent to handle the child on their own and just, get a sense for what this is like, And occasionally what happens is that the child behaves better because it's a new experience, but usually not, So that is one way to kind of get them to understand what this is like,
In preparation for today, I took the opportunity to talk to a couple people that I know. And in each of those cases, they were both working parents. So there was not a single caregiver, 100% caregiver. I understand caregiving many times falls on one person, one parent anyway, but these were in each of the cases were both working parents. The idea that you would shift off or that you would get on the same page seemed very difficult for them. So let's back it up a little bit. Is there, I understand parenting is a all day activity. It's a 24-hour activity. But if you were to suggest that one parent take the child, spend time with the child for any amount of time, is there some minimum amount that you could kind of like ease into this with? 5 minutes? Is it 20 minutes? Is it an hour? Is there something that we could kind of that would allow the stress to not be so overwhelming?
I mean, I think it depends on a lot of variables, like even the time of the day and what the activity is and what day it is and so forth. I mean, ideally it would be long enough so that the partner who gets the brunt of the caregiving gets to leave and have a break, because that is one thing I think that I would promote, is just that parents have to take care of themselves. And a lot of people, have a hard time with that. They feel guilty if they're not doing it all the time and allowing other people to do it. So I think that's a very variable thing, but I would say kind of a minimum of 2 hours or something, just to allow the other person to be gone and do something that's helpful for them in that amount of time.
And I like the idea you raised of essentially building capacity when maybe the parent who tends to be the default parent isn't there. Hopefully it helps build that relationship between.
Yeah, you want that relationship. Yeah. Mm-hmm.
I do want to acknowledge with therapies and treatments for ADHD, and I know you've also written about, looking at analysis of therapies that, what is effective. A lot of therapies that are effective for ADHD are really heavily reliant on parent intervention and really focused on the parents and what they do in all of the hours outside of maybe the hour or so a week that the child goes to therapy or that the family goes to therapy. So this particular diagnosis really does demand a lot of parents, a lot of shifting maybe ways that they were doing things. Can also be very challenging if there's other children in the household who maybe don't need to be parented in the same way.
Mm-hmm.
And I imagine when we're talking about the stress that this can put on parents, we're asking a lot of them. And again, if one parent doesn't, necessarily agree with some of the recommendations being made, that can be really challenging. And I also appreciate that you brought up that it's not unusual for parents who are parenting a child with ADHD to have ADHD themselves.
Mm-hmm.
So now we have a situation where there's a lot being asked of the parent in terms of their parenting, while they also may be trying to manage those either same or similar challenges in their own lives.
Mm-hmm. Yeah, I mean, that could be an incredible kind of compounding then. Mm-hmm. I mean, I think a lot of parents got in touch with their own ADHD from having their children diagnosed with ADHD. because, the diagnosis wasn't something that was used when they were young, and they see some of the similarities, and they come to terms with the fact that, oh, all this time I've had this. So some parents, get in touch with that, and then, get treatment for themselves and find that's helpful
Yeah.
for the parenting as well. But you're right, people who have some of the same issues in terms of organization, because you have to be really organized too, and consistent. Those are very challenging things.
So, Jackie,
Yeah.
let's just imagine that I'm a typical guy for a second, and I choose to ignore this whole thing. Okay, we don't get our child diagnosed. We live through whatever situations there are. Child is now a 27-year-old, 25-year-old adult. What happens then? What does the child look like with ADHD? What the 25-year-old look like with ADHD? What is happening in their world? And what's their relationship with their parent at that point in time?
Well, I mean, the research on this, so it doesn't speak to, of course, it's group data when it's research. It doesn't speak to every individual. But generally speaking, young adults or even, you're talking about like 27, which is not a young adult anymore. But there's poorer outcomes, in all domains really with untreated ADHD. And there was a recent, I think, JAMA article about this, that it was associated with, being treated for ADHD and long-term medication use was associated with fewer car accidents overall, fewer suicide attempts, just a whole bunch of different domains. So in general, the risk is increased for adults or young adults who have not been treated. So if you haven't been diagnosed, then you probably haven't been treated. So generally outcomes are worse, it's sad, but it's, in all sorts of really important areas.
I think this really ties into, I know your book addresses the relative values of diagnosis and receiving that label and the limitations of the label. And I wonder if you can speak to that a little bit, because when Dan references the 20-something who was not assessed, maybe didn't get the diagnosis, I know, and not in all cases, but in some cases that comes from parental fear of having their child labeled. So not go through with an assessment. And yes, could you speak to us a little bit about the relative risks, benefits, pros and cons of receiving the label versus not, and the limitations of that label?
Well, I mean, I probably won't take on the whole DSM because in general, there's issues with it. It's not a perfect system. But with the ADHD diagnosis specifically, I mean, basically the symptoms are just all observational. Just if you list the symptoms of ADHD from the DSM, it's all things that people can see. So it doesn't get at any of like what some parents want is like, why is my child like this? What are the underlying reasons? And a diagnosis based on just symptoms that are seen don't get at that, So there does have to be a differential diagnosis. Like, has this child been traumatized in some way? And the same kind of inattentive or, emotionally dysregulated or impulsive things, are they due to something else, such as trauma and not ADHD, So part of the problem with going on just simple observation is that it doesn't differentiate between those two, and you'd have to know more about the child and what they've gone through in their environment and so forth to know about that. So I think that's one limitation with the ADHD symptoms that people check off. General, it just doesn't get at the underlying thing, and that's what people are looking for sometimes. But then you also pointed out that, for some parents, it's a big relief. There's a name for this, and there's treatments developed for it. Other people suffer from it. I'm not the only one going through this. And for a lot of people, that's very reassuring, actually. Just being able to a label helps them feel a little bit more in control of the situation. And it's not just this amorphous, like terrible behavior, like all the time that they have to deal with. So it makes more sense to them. And I think, the popular conception of ADHD right now is that it's probably overdiagnosed. So I think that's a limitation that's sort of come along, is that people almost think, oh yeah, all children are being diagnosed with ADHD. And there are some times when that might be the case, but it's not very scientific in a lot of ways, because if you look throughout the United States, there's just regions where it's diagnosed more often and regions where it's not diagnosed so often. I mean, that doesn't really make sense, so there are other factors involved in diagnosis other than the child themselves and how they're acting. So in some ways, it's not as scientific as people would want. It's not exact at all. It's a category, and that's some of the drawbacks, is that my child is being labeled.
So Jackie, if being a little devious here, if I get my child diagnosed with ADHD, does that give them more time to spend on tests? Does that give them more time on the SATs? Do I give them an advantage by actually giving them a diagnosis?
Well, I mean, it's not supposed to be that way. It's supposed to be an accommodation that helps them achieve what other kids would achieve without that necessary part put in, such as increased time. So, do I think that some parents might have done that? I mean, probably, right? Potentially. And maybe their cases are more borderline, but hopefully, the providers would also be ethical about this and only give, a designation when it's deserved, which I think providers do when they're doing an assessment. Like if a psychologist is doing a thorough assessment, they're not going to be gamed, but medical doctors are the ones who diagnose now more than anyone. Pediatricians do. So, they don't have very much time to be spending on mental health issues. So they're limited in terms of their training, their time that they have with people, and, how closely they're following guidance for them. So there's just a lot of factors. And I think there is a bit of an issue with pediatricians being the top diagnosers now. Although it also makes sense because they're the ones who know the child, hopefully the best, and have seen them over time and have been able to rule out some of the potential physical causes that, always have to be first looked at. That's the priority, to look at any physical reasons for why a child is acting that way. So it makes sense in a lot of ways, but in other ways, it doesn't help us have a really thorough assessment.
Yeah, I'd like to see, ideally, once that first contact has happened with a pediatrician, that there's ideally some follow-up with a psychologist or other mental health professional for more thorough assessment. And I think for more targeted treatment recommendations, because obviously ADHD shares a lot of common features, but I find that it doesn't present in every kid the same. We even have types of it, of course. So I think working with a mental health professional can really help a family identify what might work best for their child in their circumstances.
Yes, definitely.
Go back to parents just for a second, because Jackie, you mentioned this early on. Study I read said that the divorce rate among parents with a child who has ADHD is almost double that than other parents, up through the time child is 8. Something magically happens after 8 and they stay together just like everybody else does, but it's almost double. Why is that? I mean, we talk about stress, but why is that? I mean, in talking to some of the parents I did pick up a little bit of, well, that comes from his family, or that comes from her family. And
Mm.
gotta imagine that if my wife says that to me, I'm going to be immediately defensive. The walls are going to,
Mhm.
what do you mean it came from my family? What about your family? What about your brother? What about, so I imagine that there's these types of things going on, but what else is happening to those parents that's causing that divorce rate to be so high?
Well, I just think it's the stress in general and the demands and the effort it takes. They're quite extraordinary, and so it's just very, very stressful. And then we talked about the fact that there's probably going to be differing ideas, as well as the blame you're talking about, but different ideas about how to parent this child. And so there's a rift there then, that hopefully we can work with. And I mean, that's what we try to do, is to work with that and get parents to be on the same page and be on the same team. But so I think the rifts of parenting styles, like it's not compatible, and it's not, there's no bridge there. So I think that's another reason. And then another reason is just potentially the ADHD in parents. ADHD in kids is also associated with maternal depression. And maternal depression is also associated with relational problems and marital problems and increased risk there. So I think there's a few different reasons why that might be so.
I think, to me, I mean, there's so many challenging aspects of parenting, right? But when a person or a couple is anticipating the arrival of a child, you essentially don't know who's coming to live with you for the next decades or so. And while I imagine that there are a number of reasons for what we're talking about here, the added stress in a relationship when a child has ADHD, I find that, for one or both parents, it can be really hard to let go of the vision that you have for your child. If this child is presenting differently or having different needs than you had pictured, that can be a really hard adjustment for parents to make. And I find that it can often be helpful to explore, what is the meaning that the parent is assigning to hearing this diagnosis that their child has ADHD? What kind of challenges is that bringing up for them, or emotions is that bringing up for them in terms of what they thought parenting would be like, or what they thought their child would be like?
Mm-hmm. Yeah, I mean, there's grief there, right?
Right.
And sadness and envy of other parents who seem to have it easier. Like, why doesn't my child do this? Why do I have to do all this work? And they just, so sometimes I found with parents with children with ADHD, talking to other parents doesn't really help very much, because they're inevitably going to compare themselves. Like, why is it so much harder for me? And then, inadvertently, I think sometimes parents who don't have a child with ADHD might be sort of dismissive, or like, oh yeah, all kids act like that, and mine acts like that sometimes. But it's not the same, because a full diagnosis of ADHD means that it's a pervasive, extreme pattern in different settings. So it's not just one-off behavior when they're hungry, or just another reason that kids get cranky and they don't act like they're supposed to. So the support, they can't get this. I don't think that they get the good support from other parents who don't struggle with this at the same time, And then the other thing that I saw in my own study, and then other people have also done similar research, is that, accepting a diagnosis of ADHD is sort of a process. It's not like people get it and then immediately go, great, everything's solved. I mean, it takes a while to kind of get used to the idea. Is this true or not? Does this fit my child? And then inevitably parents are searching for, well, isn't part of this his personality? And isn't part of, maybe part of this is the ADHD, and surely he can control some of this, you know? So it's not clean. You know, the ADHD diagnosis itself isn't usually like the end all. It is a process of accepting that diagnosis and figuring out whether it's a fit for the child and the family, really.
How long between the two of you? You've obviously had experience in both of those. In that case, that acceptance process. How long does that take? Is that a year? Is that a month? Is that what is that?
I mean, the research I did and the other things I've seen don't put a real time frame on it, but I think just recognizing that it is a process and not just a one and done where the provider says, yes, it looks like the child is fitting this profile. It's just more of a process than we would think.
Mm-hmm. And you mentioned, Jackie, that part of the process can be grief. And I see that a lot. I see for a lot of parents, or even for people who are diagnosed as adults, there's a sense of relief in a sense. Okay, I know what this is now, and a sense of grief because this means it's going to be different than maybe I'd hoped or envisioned. So to your question, Dan, we know that when people are grieving in general, grief's not a linear process, right? And it's, you don't just neatly move through these stages and coming out on the other side. So in my experience, for a lot of parents, for a lot of children, they can cycle through that grief or, those challenges at different developmental stages too, because the way the child's ADHD manifests, the challenges that it causes, those can change at different developmental stage all the way, well into adulthood.
Yeah, that's a really good point. Yes, it's revisited as children or have different needs and different requirements, different expectations. Yeah, that's great. That's a great point.
So if this happens, I actually worked with somebody who got an ADHD diagnosis after he was working. Actually, he was a very successful guy, by the way. But I've always been curious. If I get an ADHD diagnosis when I'm 30, am I pissed off at my parents? Am I like,
why didn't they do this earlier?
Yeah.
You mean? Oh, well, I mean, I mean, they may be, but it was a different time 30 years ago or 25 or whenever they got into the school system. So, teachers didn't seem to see it either, right? So it just wasn't recognized as it is today. So there could be anger at parents for not seeing it when things seem kind of obvious to the child who's now grown up. But, there are different cohort conditions. So that certainly played a role in it. And there were other people responsible for the child too. Parents aren't the only ones. And sometimes, when I've heard about adults getting a diagnosis that late, they do feel sadness, like, oh, I think my life would have looked differently if I had been treated and I didn't have to struggle this hard and I didn't have to hear all the criticism that's been leveled at me my whole life. So there's grief there too. Like I might have lost things that could have come easier to me that now I have to deal with.
Absolutely. I find a lot of folks who are diagnosed later in life have spent a lot of years feeling misunderstood. And now how upset they are at their parents can vary. I certainly have seen adults who are diagnosed who did experience that anger, like you knew something was different, and others who were, maybe not directing those feelings towards their parents, but definitely reflected on feeling misunderstood. As you said, Jackie, just faced a lot of challenges that they wish that maybe things could have been different. And they've been diagnosed earlier. And we know, especially now that this happens a lot, even more so for girls and women, the diagnoses get missed.
Yes. And that still happens, I think, with girls, because they just don't present the same way as boys do, generally speaking, again. But in the school system, an acting out boy will get attention. just because of the disruption to the classroom in general and the other kids. But if a girl is just sort of daydreaming and kind of out of it but not causing any problems, no one's going to complain about her really. So they get overlooked for sure. Girls do still, and they more likely tend to have the inattentive type anyway. If they do have the hyperactivity and impulsivity, just because of boys' general activity levels, they're still not going to look too bad compared to the average male. So they're not seen as just being sort of wild and out of control as some boys might.
Yeah, we find especially right this time of year, as the school year starts, it's not an unusual experience for parents to hear from their child's teacher that there's concern about ADHD, maybe because there's disruptions in the classroom or at school. But again, usually that more often, not exclusively, but more often is the experience for boys. Teachers are highlighting those challenges for parents.
Yeah, and while we're on the topic of teachers, part of the assessment always should be teacher ratings. And teachers are good at identifying ADHD. They're not good at identifying all issues with children, but they are actually good at pinpointing that. So in rating scales, they tend to be more like accurate than parents sometimes. Just because they have such a baseline, like they know what kids are like, they know about average children and the expectations and so forth. So that's why they're actually pretty good reporters on this, generally speaking.
Yeah, I really appreciate you pointing that out, that the wisdom often occurs there with teachers that, hopefully can be part of a team effort
Right.
When considering or treating and managing a diagnosis.
And if we're talking about the school, and I know that parents often kind of get in they want to advocate for their child, and they get into a sort of an adversarial relationship with the school. And as much as possible, I talk to parents just about let's all be a team together, I mean, this school has its challenges. They have a lot of kids and they're dealing with this, but there's also federal law that mandates some of the things that they need to be doing. And I know school districts are very varied, so some do this very well, some not as well. But, as much as possible, not to always take things out on the school and still keep that we're working on this together. We're not enemies to each other.
Can you explore that just a little bit further? Because that actually came up in some of the discussions that I've had, where parents actually push the school to perform its mandated responsibilities. So what does that mean? What does that look like? What does the school have to do, or what are they supposed to do by law or by regulation? And how do parents access that?
Well, you have to, let's see, that's a big question. I mean, for sure, it depends on what designation a child gets. So if there's a 504 accommodation, there's some of the things that, you were speaking about earlier, like maybe increased time or some other accommodations. Then there's another one, signaling, an individualized education plan or an IEP. So that's at a more severe level, like the child's disability at that point is very much affecting their, like they're failing or getting very low grades, or they're not able to stay in the classroom because of the disability. So that's a higher designation. So usually a school will progress from a 504, which people have for a while, and then it might go to a more serious designation if those accommodations don't seem to be really helping. So there's different levels.
If the school hasn't gotten the diagnosis, hasn't helped get to the point where they can do a 504 or an IEP, can the parent ask the school to do to get their kid tested? Or
Well, they can ask, and it just depends on what level of functioning the child has in the school, whether the school will undertake that kind of testing. And it also depends a lot on the school, the resources they have, their attitude toward this, often just resources. If it's a school where a lot of kids are, there's a lot of things that the school needs to deal with, it's harder for them, I think, to be able to manage all of that well. So there's just a lot of variability in there, but any parent or actually any concerned adult that's involved with a child can request in writing from a school to hold a meeting where, the upper administration attends, the school counselor and other representatives of their special ed team, where they have a meeting and decide whether there's cause to look into this further. So any parent or a concerned adult can request that kind of cause hearing, I think it's called usually. So I think that's heartening, at least, is that any parent can request that, or an advocate can request for them. And some people do hire some legal representation to go into meetings with them, someone who has a specialty in this area, because it's complex. It has to do with laws, which people aren't very well versed in usually. And advocates with a legal background in it, know exactly what to ask for and when to, keep asking for something, or whether to pitch it up to a higher level of accommodations. So sometimes that's useful for parents too. I think it's often a good idea to get that. But again, it's resources, and a lot of parents are struggling anyway, and they don't have extra money for that kind of thing.
Right. What does that cost? Do you have any idea?
Again, it's just, it's hard to say, because it depends on the area, how high. Like, I live in the DC area. Everything's really expensive here, more so than in other parts of the state. You go to Fredericksburg, which is about technically an hour, but more so with traffic. The costs there for things are completely different, for counseling, so, it just differs so much, I think, depending on your area. I mean, and lawyers ask for retainers too. So they will ask for a retainer that will be probably more than you'll end up paying, just because they want to be assured that they will have their money at the end of the day. And you might not use all of that, but you might need to put that money up front. So there's a good list, and I think I have it in my book, of different, like a list of educational advocates, where, it's a solid list, like, because you can go different places and still not find exactly what you're looking for. I think that's a hard thing about the United States in general. We have a very fragmented mental health system. So you can access it at different points, but it's very, like, it's here and there. And, I was talking about the pediatrician, but then there's psychologists and there's social workers, and, the school is often an access point for kids to get mental health services. But it's quite piecemeal, and it takes a bit of work to figure it out. So in the book, I do try to provide a lot of resources, so parents aren't just running around or just give up, because it's like, this is so complicated. I can't handle all of this. So I try to point people in certain directions at, valid sites that can help them get the treatment or services that they need.
Erica, I'm sorry. Go ahead.
I was thinking, circling back to near where we started, we were talking about, these challenges for parents when their child does have a diagnosis, and how parents can really not see eye to eye. And as we're talking about these other systems that interact with kids who may have an ADHD diagnosis as well, what's coming up for me is what I hear time and time again. I hear it from parents, I've heard it from teachers, I've heard it from other adults that interact with kids, is when being asked to make an adjustment to the way the child's being parented, or, the way that academics or disciplines being handled in school, this idea that, well, if we make these adjustments, we're not preparing them for the real world, right? The real world's not going to do this for them. The real world's not going to treat them like this. Curious if that comes up for you, Jackie, in your own work, and if you could speak to that a little bit, that concern that's not uncommon among adults.
Yeah, I mean, I do hear that. I mean, my response is, Jenna, I'm sure you've come up with responses that you have to that kind of thing, but my response is just typically like, this is a transition, you're doing this so that you can help your child right now. And maybe they do need the external in order to do something. Yes, we do want them to be internally motivated, but it might not be right now, and over time, yes, we would hope that they would gain these skills, and we're not going to be rewarding them, forever. We're going to wean them off certain rewards and then have higher goals for them that they then have to meet. So this is to be looked at as a temporary or transitional idea to get them successful so that they can eventually do the things that life requires, and that it will be internal, but it's not right now, maybe,
Yeah, absolutely. Yes, I often find myself speaking to adults about, if your child was having trouble reading, yelling at them to read better or punishing them for not reading is not going to help them to learn how to read, right? Sometimes there needs to be some extra tutoring, extra intervention to get them at the place we'd like them to be at this age, so that they can become a better reader from there.
Mm-hmm. Yes, right, exactly. And yeah, just the frustration, right? Like, maybe parents were yelled at and that was the parenting style that they heard, but it could be a constant. Yeah, I mean, you could be yelling all day if you have a child that has these challenges. I mean, you could literally be like screaming all day long, if you let yourself, right? So that's why it's like, just keeping your own emotional regulation throughout all of this when it's so trying, and it just requires so much patience. And if parents have the means, which they often don't, but if they can farm out some of it, like you talked about tutoring, it's very hard for a parent to play all the roles, right? So like to catch them up academically, oh yeah, work with your child to do this, but it's like, that can also kind of hurt the relationship when you become kind of this teacher role, because you're trying to get them to do something they really don't want to do now, which you've been doing all day. And it's just a lot to ask though, and it can be kind of wreck the relationship when you're trying to get them to do things that the school expects. So I think like when there are means to be able to farm out some of this, so someone else takes that on. So it's not about you all the time. It's someone else saying these things, and they've been trained on how to do it. And most parents haven't been.
Yeah. I mean, in a model of the parents sort of being the head coach of the team, but having a number of assistant coaches.
Yeah, that's a great analogy. Yeah, that's a good one.
So I want to be respectful of everybody's time. We really dove deep into ADHD. I'd like to, if you have time at a later date, Jackie, I'd like you to come back, and I'd like to focus in on anxiety, because as I was talking to people, anxiety just kept popping up, both for themselves and for their children. But I wanted to give each of you, a minute to talk about, to summarize and or talk about the latest books or anything else that you may wanted to talk about. Erica, I'll start with you. Floor is yours.
Sure. In my own clinical experience, and I think a lot of this was highlighted in our discussion with Jackie today, by the time a parent or parents may be bringing their child in for an assessment for ADHD, they're exhausted, dealing with a lot of challenging behaviors and seeing ways that their child may differ from their peers for years. And so I really want to approach that with a lot of compassion.
Mm-hmm.
And And we talked about the role of grief, even for the parents who are not shocked to receive that diagnosis, even for the parents who may experience some relief at the diagnosis, it still is a shift in maybe what the expectation was for being a parent or for parenting that child. So again, I really want to meet parents with understanding and compassion for that part of the experience as well.
Mhm.
From there, would really want to encourage parents, openness and sort of flexible thinking to maybe some of the recommendations that are being made for doing things differently, maybe even differently than you're doing for your other children if you're parenting more than one child. Because the goal here is to help the child to build skills, to manage differences, to succeed, right? To succeed, to feel a sense of success as a child, eventually as an adult, and also to really help the whole household. You mentioned, Jackie, like it can be really hard to parent a child with ADHD, but it's really also hard to live in a house where everyone's yelling all the time.
Mhm.
And so really want to encourage parents who may be on this journey, new to this journey, to reach out to the multiple resources that are available, whether that's through a therapy practice.
Mhm.
We always have to be careful about what we're consuming on social media, but there really are a lot of great accounts out there and resources for parents and for kids themselves. So I encourage folks to avail themselves to those resources.
Mhm. Yeah, and you were talking about the family, and siblings oftentimes feel ignored. So, parents have a limit to their bandwidth for sure, but just knowing that some siblings will feel like the ADHD child is taking up everything and
Mm.
sucking the air out of the room when they're there. So trying to manage that as well. It's a lot to ask, That's why I think compassion is very much needed for parents going through this because it is so challenging. But there are other kids also need the special time and to have attention and so forth because the needs can really take over the family and the parents' attention. So just something else we didn't talk about.
Jackie, what about you?
What do you want, last thoughts or?
Last thoughts.
Oh, well, we didn't really talk about the possibility of children developing sort of the more antisocial kinds of things or the angry disorders such as, oppositional defiant disorder or conduct disorder. But it's very common with ADHD to develop these. It's not all children, but it could be as high as 50%. So I think one real motivator for the parenting to be different maybe than you were brought up or that you do for other children is the parenting techniques are really important so that we don't also get these other, even sometimes more difficult problems that might develop with the kids with ADHD are at risk of.
Great. All right. Before I close, I did want to say this discussion brought up two things. Distant memory in my past. You were talking about parents hollering all the time. I had a friend or at one point in time, and his he had some neighbors, and they used to use the last name, which just use Smith. They'd call them the hollering Smiths because they were all yelling at each other. So
Yeah.
we had something to do either with there could be a number of things that it could be responsible, but it was that constant hollering. It was kind of a joke. But the second thing is the thought that if you have multiple children, if one or two have a diagnosis or have issues such as ADHD, it did pop up in my discussions where the other children feel left out, and so
Mhm.
they literally had to do something special for them. It was good that it happened, but it was kind of unexpected. I really wasn't expecting to hear that as I was researching and talking to people. So we'll go from there.
Mhm.
Our sponsor today is Equilibria Psychological and Consultation Services, whose mission is to help individuals achieve their personal potential and long-term growth by compassionately and respectfully helping clients live in balance. Visit equilibriapcs.com, equilibriapcs.com. You can look for them on Facebook, Instagram, and LinkedIn. Also look for me on Instagram, Daniel J. Gomez 24, and on LinkedIn. Now for the disclaimer. I am not a medical professional, and I am not providing medical advice. The opinion of our speakers is solely their own. This podcast is copyrighted and cannot be reproduced without the express written consent of EPCS Management, LLC.